So, good evening to everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaz. And SPM, sleep promoting medicine. You have to know how to conquer it. So, there are totally 3,500 points in the entire preventive medicine. First time, it is boring, it is drowsy, and it is comatose experience to read through these 3,500. But once you go through these 3,500 points, which hardly will take around 100 points an hour, which is about 35 hours of your time. Out of the 3,500 points, almost 2,500 points don't need second reading. Out of the remaining 1,000 points, 500 points require your attention in the last moment, last 30-40 days before exam, and another 500 points at least one more time of revision. So that is the game into which we are, and every day evening at 6 to 8 p.m. we will take opportunity to revise at least 200 points, and every Sunday we have a grand test with discussion. So totally we will be revising about 60,000 points in 19 subjects put together. And this takes 600 hours of our journey together. So with that preamble, let's make the great beginning, Doctor. So in our previous sessions, we finished 500 points. Live vaccines versus killed vaccines, which is more potent? Obviously, the live vaccine is more potent. Have you given the notes to both of them? Yeah, very good. So go to the point number 505 in that. Live vaccines, what is the advantage? That the organism is live attenuated. That's the reason it will multiply in the host. It will cause the antigenic response, which is more higher compared to that of the killed vaccine. And live vaccine has both the major antigen and also the minor antigen. Both of them are there in the live vaccine. That's what you need to basically remember. Then live vaccines basically engage with certain tissues. Suppose if you take the oral poliovirus, that attenuated poliovirus strain goes to the Peyer's patches and multiplies over there in the intestinal mucosa. So that is one speciality of the live vaccines. Similarly, live vaccines can persist as a latent virus to constantly provide you a long-living antibody response. That is an advantage with the live vaccine. Best example, killed vaccine is your COVID vaccine. But you need to keep on taking boosters. Whereas if it is a live attenuated vaccine, once you take, you don't need to take forever. But the only exception is OPV. OPV, in spite of being a live attenuated virus vaccine, you need to take multiple booster doses. That's the only exception. Now, generally live vaccines, how many doses needed? You just need single dose. The only exception is OPV, where you need to use 4 doses is what you need to emphatically remember. And another thing about live vaccines, don't give it in the immunocompromised, immunosuppressed people. That is, those people who are receiving chemotherapy, those who had organ transplant, those who have autoimmune conditions, don't give a live vaccine. You should remember the contraindications. 2 live vaccines, can you give? Yes, sir. You can give simultaneously, but at different sites. That is, in the same place, you can't give BCG and measles together. So You can give at two different sites or at an interval of 3 weeks separated from each other. So that is a benchmark you need to remember. BCG, what is that? Bacilli calamity guarine. It is an virulent strain. After 239 subcultures over a period of 13 years, it is being attenuated. That's what we need to remember. So what is MBBS? We are attenuated intellect. We are being compressed for 6 years and made to become snobs. So be very sure. So BCG number 1, it is a live attenuated vaccine. It's a liquid typed vaccine. Lyophilized, freeze-dried vaccine. And by lyophilization, we are making it more stable. That's the point you need to remember. And what do we use to reconstitute the BCG? Normal saline. And it should be used within 1 hour after reconstitution. And the dose is 0.1 ml for all the ages. And it is intradermal route. And the strength is 0.1 milligram for 1 ml. Tomorrow when you become cardiologist, you don't need all this gibberish. But to become cardiologist, you need all this. Unfortunately, you need to remember. So BCG is a live attenuated, liquid fresh type, lyophilized, freeze-dried vaccine is what you have to emphatically remember. And from which strain, the BCG vaccine strain is which one? It is the Mycobacterium bovis, not tuberculosis. That's the point you need to appreciate. And it is the BCG lab in Guindy, Chennai, in India, is the point. Now comes tuberculin syringe. So we are all image-based MCQs. One of the MCQ will be given is, this will be given and asked, what is this? So it is the Omega microstat syringe. What is the gauze? It is 26 gauze needle. That's a point you need to remember. Now, it is the skin over the left deltoid, not right, left deltoid. So why only left deltoid was an innocent question of a medical student once upon a time. Professor didn't know actually. The answer is, it is only by convention. It is only by convention, right? So during the wedding matrimony, now you may kiss the bride. Why they don't say now you may kiss the groom? That was what I was asking the priest the other day. That why they don't say you may ask to groom? So it's by convention, right? So, or maybe the groom will faint with the first kiss. So direct BCG is administered up to 1 year of age. And why? When do you call direct? If you don't do MAN2, then that is called direct BCG. And when do you call indirect BCG? Beyond 1 year, if you want to give BCG, you need to first do the MAN2. If already the guy is MAN2 positive, then he is already sensitized. You won't give the BCG. So indirect BCG is given beyond the age of 1 year after a prior MAN2. That's the point you need to appreciate. Now, what will happen if you give BCG? If you give BCG after 2 to 3 weeks, a papule will form. 5 weeks, 4 to 8 millimeter papule. 6 to 8 weeks, it will break into shallow ulcer covered with a crust. 6 to 12 weeks, a permanent tiny round scar will form, which is 4 to 8 millimeters. 8 to 14 weeks, the person become MAN2 positive. So this is the favorite MCQ of examiner, doctor. After how many weeks after the BCG vaccine, the person become MAN2 positive? You need to be very sure it is 8 to 14 weeks is what you need to remember. Now, how protective is BCG? If you take BCG, is there any guarantee that you don't get TB? No, sir. It is 0%. If you take coaching with Dr. Murali Bharadwaz, is there any guarantee that you will definitely get seed? 0% chances are there if you don't study. Because the job of Murali Bharadwaj is to study on your behalf, prepare notes on your behalf, give you the notes and explain the notes. That's all. After that, to remember, reproduce is your job, right? For severe form of TB, 80% protection, definitely. At least if you take coaching, you don't do anything but only listen, you will definitely qualify. Right? Now for leprosy, protection is 20 to 40%. That means if you take coaching with Dr. Murali Bharadwaz, you don't need to join MD-SPM. Right? The chances of protection against leprosy is 20 to 40%. Right? So protective duration of BCG is for how long? It is for 20 years, right? Is the protection. So these are all what numerics. Some of these numerics you will remember lifetime. Once you heard here, you will remember lifetime. But the problem is some you can't remember. Those you just check mark. No need of writing notes. In the notes given, you just check mark, right? Is that notes containing all these points? Yeah, good. Now, what are the complications of BCG? Is a very important question. So, any severe ulceration, suppurative lymphadenitis, osteomyelitis, disseminated BCG, all these are the issues. That's what you need to remember. Now, measles vaccine. What are the type of it? Measles vaccine also a live attenuated, lyophilized, freeze-dried vaccine. And where do you conduct how do you develop vaccine? Chick embryo or human diploid cell line is the place where the organism is being attenuated. Now comes 3 points that you should not forget on measles. 0.5 ml subcutaneous route and anterolateral aspect of the thigh in the middle 1/3. This is what you need to be very, very clear about. Now, age of administration. When do you give the measles vaccine? 9 months. But if there is malnutrition, if there is any epidemic, there you can make it 6 to 9 months. That's what you need to remember. And how do you dilute measles vaccine? We use sterile water or water, not normal saline. Normal saline for BCG. Simple things only. After coming from exam hall, it is not normal saline, we will say. Already 20,000 people crossed your head, right? And use within 1 hour after reconstitution with diluent. See, doctor, there are certain things in our life we think they are happening first time. Like, before joining MBBS, while preparing for MBBS, you thought it's the first time I'm becoming doctor. But when you join MBBS, no? Oh my God. When you look at seniors, you'll think, this fellow is also MBBS. That fellow also cracked MBBS entrance. How did this fellow who don't know 17 into 14 is how much also cracked MBBS entrance? After that, when you are going for anatomy exam, you're gasping for breath. Embryology, histology, osteology, wow. Ossification centers and all. But that same MBBS exam, same issue, almost all probably your uncle or aunt might have sat in the same place and prepared a few years ago while I was teaching. So even the time may come where your grandpa also took coaching with me, right? So I'm now 48 and my son who is getting married is 24. My younger son is 12-year-old. So another 4 or 5 years he is going to get into medical college. So I was telling that one day will come where the student who is sitting there, grandpa will be my student. So measles vaccine can lead to toxic shocks. Why I'm saying that is, these are all standard things. Standard points, a poor examiner is expecting you to know and come. And if you don't know these 60,000 points, at least once, impossible to crack exam. What is a topper? A topper is the one at least who knows 40,000 points. A one who qualified in exam is the one who know at least 15,000 points. Below that, if you don't know BCG is even a live attenuated vaccine, you are thinking it is killed and then you are also killed, right? Be very sure. So measles can lead to toxic shock syndrome is a complication that you need to remember. Measles is live attenuated. That's the reason you can't give in pregnancy. You fully agree with me, right? And what is the cold chain temperature for storage of measles vaccine? +2 to +8 degrees. Remember, if nothing comes to your mind, no, you answer +2 to +8, that become answer. In fact, 2 to 8 degrees is called the cold chain temperature. There are few exceptions where you use a different temperature, but generally it is +2 to +8. Protective efficacy. More than 90% is the protective efficacy even with one dose of measles vaccine is what you need to remember. And measles vaccine is a live attenuated vaccine. It remains latent in the body. That's the reason lifelong is the immunity of the measles vaccine. Incubation period of measles, the vaccine-induced measles is 7 days. Actual measles is 10 days. That's the reason if somebody got exposed to a case of measles, within the next 3 days, of window period, if you happen to give measles vaccine, still he will get protected. Because measles vaccine induced incubation period is 7 days, actual organisms is 10 days. So post exposure after 3 days, you can still administer measles vaccine and provide the protection. Between 2 successive doses of the measles, it is 6 months, should be the ideal gap between 2 successive doses. Now, OPV is oral. Oral polio vaccine is Sabin. IPV, there is one more injectable polio virus. It is Salk. Salk is killed. Salk is a killed vaccine. And oral polio vaccine is a live. So how do you remember? Which is Salk, which is Sabin? Very good. K is killed. K is IPV. Obviously, the other one is OPV. So, live attenuated virus, it induces both humoral and intestinal immunity. Which one? OPV. That is nasal, duodenal, IgA will become created, and IgM, IgG, IgA. All the 3 will appear. It prevents paralysis plus intestinal reinfection. To control epidemic, you need to have something that you leave, that everybody start excreting in the stool so that the wild virus get displaced. So hence it is used to control of epidemic. And during epidemic, you can't give an IM injection. That's the reason you can't use IPV, in fact, during epidemics. Any injection you can't give during polio epidemic. Intramuscular you will avoid. That's the reason OPV is ideal for even during epidemics, is what you need to remember. It is easier to manufacture than IPV, cheaper than IPV. Storage requires sub-zero temperature. Lot of times, the main reason for the failure of OPV vaccine is temperature failure. And the shelf life is shorter than IPV for the OPV. But one issue with live attenuated vaccine OPV, which is unique to OPV, but not seen in IPV, is VAP. Vaccine associated polio paralysis is called VAP. The risk of the VAP is 1 per 1 million vaccinees, which is more than IPV. That's the point you need to appreciate. Then coming to the IPV. IPV is a killed formalized virus, right? Killed formalized virus is what you need to remember. Yeah. Subcutaneous or IM, even subcutaneous you can give. It causes humoral immunity. So IgM, IgG, IgA can happen. It prevents paralysis, not intestinal reinfection. It is not good in epidemics. It requires less stringent condition for storage and transport compared to OPV. And VAP, zero incidence, no risk. That way it is safer, is what you need to remember. So what is the schedule of IPV? First 3 doses at 1 to 2 month interval each, and 4th dose at 6 to 12 months of last dose. That's the point. Now what is the composition of IPV? Purely Pattimarnaval item. Nothing to do on your becoming neurologist, right? Type 1 20D, type 2 2D, type 3 4D antigenic units. That is the regular IPV. There is an improvised IPV. That makes SPM truly sleep promoting. Lullaby, Lata Mangeshkar, Lullaby. 40D, 2 to 8D, 3 to 32D. First, knowing regular IPV composition, it's a waste of few gray cells in the brain, right? So, doctor. But IPV is safe in immunodeficiency. Safe in people who are taking steroid or radiotherapy. It can be used in the people above the age of 50. Safe during pregnancy. No risk of vaccine-associated paralysis. 5 points you need to remember about IPV is what you need to remember. And why IPV is unsuitable for epidemics is a very important question. Is the voice loud and clear online? Please check. Yeah. Immunity is not rapidly achieved with IPV because more than 1 dose is needed. And in the epidemic, if you give any injection, that precipitates paralysis. So you don't want to take that risk with IPV. Now, what is the schedule of OPV, doctor? At birth, 0 dose. 1 to 6 weeks, at 6 weeks, the OPV 1 dose, right? Then OPV 2 at 10 weeks, OPV 3 at 14 weeks. And the booster is 16 to 24 months by the 2nd birthday is what you need to remember. And where does it multiply? In the interstitial epithelial cells. And also it will multiply in the Peyer's patches, right? Which is the lymphoid tissue of the intestine is what you need to remember. Once more came, but this is worth remembering. OPV composition. Type 1, 3 lakhs. Type 2, 1 lakh. Type 3, 3 lakhs. That is what you remember about the composition. And how many drops? 2 drops, equivalent to 0.1 ml is what you basically put the drop. And 1 dose of OPV itself will produce substantial immunity, which is an advantage. And it is a very thermolabile vaccine, is what you need to remember. And always, OPV, when you reconstitute, don't once more put it back in the fridge, right? Like nurses have weird habits, right? So don't repeatedly freeze and thaw it, because it should not be done like that with the OPV. If you didn't use, discard. And cold chain temperature, if you want to do long-term storage of the OPV, how much it is? -20 to -40 degrees temperature is the way long-term storage of the OPV is required. And where do you put during transportation of the OPV? Dry ice, that is solidified carbon dioxide, and a freezing temperature with a freezing mixture, which is wet ice and ammonium chloride, is what you need to remember. Tomorrow, when you become pediatrician, all this matter. Once more, pediatrician's job, what do you think? Oh, MD Pediatrics, a beautiful branch, you'll be thinking. But pediatrics, common cold, common cold. You will see 200 patients, out of which 160 will be common cold. And maybe 1 or 2 cases, maybe pediatric cardiology of ASD or VSD, right? But we see 200 in order to get the kick of catching that 1 case, right? And parents will be pressurizing you, start antibiotics, start antibiotics. You'll be thinking, I did MD Pediatrics from PGH Chandigarh to finally write antibiotics for a viral infection, right? And mothers know more antibiotics than you. That is the worst part. Doctor, do you know what is the indication for imipenem? The mother will ask, oh, is it? Tell me. It's at least a revision of subject. So that's the point. Now, heat stabilized OPV. What is heat stabilized OPV? It is that form of OPV which can be kept for 1 year at 4 degrees Celsius and at room temperature even for a month. That is called a heat stabilized variety of OPV vaccine is what you need to remember. Now on that vaccine vial, you have what is called vaccine vial monitor, VVM. So iska story kya hai? You want to know whether the vaccine is potent or whether it is stored well or not, you will know by looking at the vaccine vial, right? So that is vaccine vial monitor. So vaccine vial monitor is the one which enables you to know about the efficiency of the cold chain transport. Whether you have maintained the optimum cold temperature or not is very important. अच्छा, a vaccine vial में क्या होता है? So what will be there in the vaccine vial? You have an outer circle. You have an outer circle. Is the broadcast fine? Online, can you please check? Yeah. Good to see Neelu Sharma and many more who are all online. Very good, very good, very good. So there is one outer circle, inner square. ये outer circle का color बदलता नहीं. Always it is the same color. And the inner circle is the square, is the one which is made up of the inner square is the one which is made up of heat sensitive material. All right. Now, only inner square changes in color. The inner square only changes in color. You are able to see? Whereas the outer square always is blue. To know the contrast, outer circle is being created. Right? Simple. Now, WHO has created 1, 2, 3, 4 grades of that central square color changes. And up to grade 2, grade 1, grade 2, you can use. Grade 3, you can't. Grade 4, you can't. Now, let us look at what are these grades. Outer circle blue, inner circle white is grade 1. You can use it perfect. Outer circle blue, inner circle light blue. You can still use it, grade 2. Outer circle blue, inner circle also blue. You can't use. Grade 4, outer circle blue, inner circle is purple or black. You can't use. Simple. Right? So examiner कल के एग्जाम में क्या करता? एक इमेज बेस्ड क्वेश्चन देके भैया ये vaccine vial hai, is it usable or not? He will ask you. So grade 1 you can use, grade 2 you can use, grade 3 cannot be used, and grade 4 also cannot be used is what you need to remember. Now comes the DPT, diphtheria, pertussis, tetanus. Let us talk few points about it. D and T are toxoids. That is, the toxin is made to get altered in its structure and remain antigenic. P is killed acellular bacilli. That is the story of DPT. Achha, 5 points about DPT. 0.5 ml is the dose. Intramuscular is the dose. Is the route of administration. Intramuscular. Right? Only intramuscular, not subcutaneous, not intradermal. Anterolateral aspect of the thigh. In the middle 1/3. Earlier they used to say given gluteal, but a lot of fat in the buttocks in the children make it not efficient. So anterolateral aspect of the thigh, middle third, is the place. So what is the composition of the DPT? Another waste of life. There are two types of DPT vaccine. इसको और miserable life करने के लिए एक one is GlaxoSmithKline and the other one is Kasauli in Himachal Pradesh का. So once more, ये दोनों के बीच में क्या फर्क है? Glaxo is 25 Loeffler units. Kasauli is 30. The what diphtheria toxide. Similarly, tetanus toxide. Glaxo is 5 Loeffler. Kasauli is 10 Loeffler. And I'm not going to read all these things. I'm going to leave to you, right? But I want to tell you, this is one point you have to keep in miserably forgettable points. So once you are attending with Dr. Murali Bharadwaz, you will not need any other notes. I will give you 60,000 points, 2,500 pages notes, right? Constituting 19 subjects. अगर ये 60,000 points के beyond examiner पूछे तो मेरा जिम्मेदारी. पर आपका जिम्मेदारी, you have to give 600 hours of your time to attend with Dr. Murali Bharadwaz. 100 points per hour. स्पीड में हम 60,000 खत्म करेंगे. खत्म करने के बाद मॉक टेस्ट भी लेना है एवरी संडे. Come to the center, sit sincerely for 3 hours, 9 to 12. 12 o'clock I will come and we will have a discussion, right? So then out of 60,000, you will don't need second revision for almost 40,000 points. You don't need second revision. At least 15,000 points need your second look. And 5,000 points are stupid, mad, idiotic, cynical. I'll try to find a synonym list to curse them. You need to do revision in the last 30 days. एग्जाम को जाने के पहले ही आपके दिल में वो कॉन्फिडेंस आना, मेरे पास 60,000 bullets है to fight with the examiner, right? So that is most important. And the secret of winning, doctor, is you don't need to read so much of information. Examiner's question bank is very finite knowledge. वो finite knowledge को capture करने के लिए you to have a very finite time, not infinite time. If you have that focus, clarity, perseverance, and ability to assimilate and reproduce in the last minute without tension, you will be in the top rank. But if you see that video library is better, this teacher is better, that coaching is better, and here and there, if you run around, right? Gone. Right? Luckily today, entrance coaching books are so well written that you don't get time or need of reading even textbooks. We are making it condensed much more easier for you. 2,500 में 60,000 points दे रहे और उसको master करो खत्म, right? After that, you yourself can start a coaching program, right? Thiomersal, it is the preservative which is used in DPT vaccine, is what you need to remember. Now, what is the immunization schedule? DPT 1, 6 weeks. DPT 2, 10 weeks. DPT 3, 14 weeks. DPT booster, 16 to 24. Another DPT booster, 5 years. Dharma Garam, you need to remember. And interval of time between the 3 successive doses of DPT. Generally 1 month to 2 months gap between 2 successive doses of DPT. एक theory है. Second is only 1 month interval, दूसरा theory है. दोनों में they found 2 months difference of gap doesn't differ from 1 month gap, just like COVID booster, right? So 1 month only they kept as a gap. And what are the contraindication for DPT? Severe hypersensitivity. Previous dose ko hai to don't give it once more. Progressive neurological disease, agar hai to, like active epilepsy, don't give DPT. Now comes a very interesting thing. Suppose if there is a history of epilepsy, if there are seizures, if the patient seizures are controlled with anti-epileptics, is it a contraindication? No, sir. If the seizures are there, well controlled with medications, you can still give the DPT. But if it is an active epilepsy not under the control, then don't give. Cerebral palsy is what? Non-progressive neurological deficit it is. It won't progress. Once cerebral palsy, it remains static throughout life. So cerebral palsy, though neurological disease, is not a contraindication to the DPT. These are 2 points you need to basically remember. So active epilepsy, contraindicated. Epilepsy on anti-epileptic, well controlled, can be given. Cerebral palsy can be given. That's the point you need to understand. Now there are 2 vaccines जिसके वजह से बुखार आएगा other than COVID. DPT vaccine, measles vaccine. With COVID vaccine, even if fever does not come, we feel feverish, right? So DPT vaccine, measles vaccine can result in fever. And the antipyretic should be given along with the DPT vaccine, take home, use meat-based, right? Now, cold chain temperature कितना होता है? कभी भी cold chain बोले तो आप क्या याद रखेगा? +2 to +8 degrees temperature. If the DPT vaccine got frozen, refrigerator का temperature बढ़ गया, right? Then you discard the vaccine. Don't just to bring it back and put it in heater, right? So that's a point you need to remember. Then adult type of DPT. Adult में क्या होता? P को cancel करेगा, खाली D और T देगा. You will only give D and T. It contains 2 low-floor units of diphtheria toxoid, and it is given 2 doses, 4 to 6 weeks apart, followed by a booster after 6 to 12 months. And it is useful for immunizing the children above the age of 12 years of age and adults. That is the story of adult type of diphtheria tetanus vaccination is what you need to remember. Now comes the most important point you need to tick mark and revise in the last 30 days before exam. National immunization schedule. Forget about remembering it for entrance. Forget about for doing good for patients. You have to remember it for your own children, right? So BCG and OPV 0. So my son who is getting married tomorrow, who is 24-year-old, I was preparing for entrance while he was a 1-year-old kid playing with me, right? I was not even qualified in that first attempt. I was thinking already kid is there, right? Married when I was in a final year MBBS. I ran away with a girl with whom I'm living even now, and married in Arya Samaj. So I was thinking, kya hoga? I was in love marriage and then married a girl against the world, right? And need to survive. What to do? But as you need to have confidence on yourself. My karke dikhaunga kind of a confidence should be there, right? So a lot of students ask, should marriage first or entrance first, right? I say there is nothing like which is first. If you are very focused, sure on what you want to achieve, even marriage requires focus. And marriage requires perseverance, consistency, right? You need to be ultra romantic after 25, 20, 30 years also, right? So that's the reason. These things are needed because your own kid require vaccination shortly. So typically at 6 weeks, DPT1, OPV1, Hep B1, and H1 Haemophilus influenza 1. At 10 weeks, DPT2, OPV2, Hep B2, HIB2, right? H influenza 2. Then at 14 weeks, DPT3, OPV3, Hep3, and HIB3. At 9 months, measles, first dose, and vitamin A, 1 lakh international units, and vitamin A after that, 2 lakh international units you will give every 6 months till the age of 5 years. That's what you need to remember about the vitamin A. 16 to 24 months, you will give DPT booster and OPV booster, Japanese encephalitis, and the live measles second dose. At 5 to 6 years, you give DPT, and at 10 years TT, at 16 years TT. So this is the whole story of immunization schedule. By heart, you need to basically remember. Now, yeah. So good to see Neelu and many more who are all online. Now, for pregnant women, how do you administer? For pregnant women, so you need to remember TT1 and TT2 should be 1 month apart for the pregnant women, and TT booster need to be given if the 2 TT doses are received in the last 3 years. For example, पहला बच्चा पैदा हो गया कब? MD फर्स्ट ईयर में. दूसरा बच्चा अभी रेडी हो गया MD फाइनल ईयर में. तो फर्स्ट ईयर में जब कर रहे हो तो टीटी मिल गया ना. सो थर्ड ईयर में क्या देना? खाली बूस्टर देना पड़ता. हाँ. नाउ विटामिन ए, हाउ डू यू एडमिनिस्टर? सो टोटली you will give 9th, 18th, 24th, 30th, 36th, 42nd, 48th, 54th and 60th month of life. 16th month कितना होता? 5 years. 48 means 4th year. 36th month is 3 years. Right? So you start at 9th month. So at the 9th month, how much you give? When he comes for the measles, 1 lakh units. Vitamin A. After that, 2 lakh, 2 lakh, 2 lakh, 2 lakh, 2 lakh until 60th month. How many? Second, third, fourth, fifth, sixth, seventh, 8th, 9th. So totally 10 doses. Out of the first dose is 1. Remaining 9 doses are second, third, fourth, fifth, sixth, seventh, 8th, 9th. Are all 2 lakh international units, and totally kitna ho gaya? 17 lakh international units is given to a completely immunize to provide the child up to the age of 5 years is what you need to remember. So OPV, minimum 5 doses are required for the development of immunity is what you need to remember. Now minimum doses you need to be very sure. DPT, minimum 3 doses given a month apart, and a booster after the first year of the last dose, third dose, and another booster at 5th to 6th year. So this you have to be very, very clear, right? Now TT, a fully immunized adult requires 7 doses of TT, totally 7 doses of TT, excluding pregnancy in females. And the duration of protection kitne saal rehta hai? 2 doses of TT if you take in this pregnancy, for the subsequent pregnancies that happen in the next 3 years. There's a reason in the recent, within 3 years, if she is once more pregnant, you just need to give booster, that's all. Now, what are the guidelines for TT? Very important question, doctor. Very practical question. वो कितना ग्लैक्सो में कितना रहता, Kasauli mein kitna rehta, that's all boring. But this is practical. If you don't know, your village woman will come with a Google and say, according to this I need to be given this many doses. I'm going to sue you, doctor. She will say. So 2 doses, 1 month apart, as soon as possible, is the most important rule. Right? उसके लिए मुहूर्त कुछ भी नहीं है. वो पहला आपके आंगन में आ गया तो प्रेग्नेंट वुमेन शुरू करो. 2 doses. So what are the guidelines for TT in pregnancy in a multigravida? If she is completely, if she completely immunized in the last 3 years, right? Completely means 2 doses mil gaya to 1 booster dose de dena. If she is partially immunized in previous pregnancy in the last 3 years, that means she did not receive 2 doses. Only 1 dose she received in a previous pregnancy. Because by the time she came very late. Then you have given at least 1 dose. Then this time she need to receive 2 doses 1 month apart. If she is unimmunized in the previous pregnancy in the last 3 years, she will tell, last time we TT nahi diya, abhi kyo de rahe ho? So 2 doses 1 month apart. If completely immunized in the previous pregnancy but earlier than 3 years, then once more her status comes back to 2 doses 1 month apart. Definitely, एक MCQ definitely आएगा. Out of this, you have to be 100% sure. And this point, if you properly remember and incline yourself in the context of a pregnant woman coming to you, you don't need second revision. Be very sure, right? Now, what is the rule for the delayed immunization of TT in pregnancy? Suppose, this is very important story. Rule for the delayed immunization. Suppose if she came late, better late than never. Whether it is war or love, better late than never. So, if you miss the chance to propose love in first MBBS, at least propose her before internship is over. Because after that, no one will look at each other's face. Give 2 doses of TT 1 month apart any time in pregnancy, irrespective of time of delivery. Right? That is very important. Suppose she came at 32 weeks. By 36 weeks, she is going to deliver. Doesn't matter. 32nd week है तो immediately एक TT दे दो और 4 हफ्ते के बाद और एक TT दे दो और next day delivery करो, चलेगा. So that she comes under what? If you do that, completely immunized in this pregnancy. But if she become pregnant in the next 3 years, then she require only a booster. That's the point you need to remember. So if the pregnant woman reports for the first time, when by 4.5 months of period of gestation, 2 doses, 1 each at 4.5 and 5.5 months. If she came at 5th month, then give 1 dose at 5th and 6th month. If she came in 6th month, give 2 doses 6th and 7th month. If she came at 7th month, give it 7th and 8th month. Right? Probably you may say, sir, your earlier slide told the same thing. No, why are you re-emphasizing? Each of this is an MCQ in different entrances. She came at 6th month, what do you want to do? She came at 7th month, what do you want to do? Give it 7th and 8th, give it 6th and 7th, right? 8th month she came. Give 8th and 9th month. And she came at 9th month. You give first at 9th month and second 1 month after the delivery. Right? You give first 1 dosage and then deliver and then give second dose. If she came just before delivery, she is in labor, she came, then what you need to give? Before the baby is delivered, give first TT and then deliver. And second, you give 1 month after delivery. But she came after delivery. After delivery, baby delivered, baby didn't have tetanus. She came to you, then what will you do? You give 1, at least once more. In spite of that, you give 2 doses. 1 at just after delivery and 1 month later, post-delivery. That's the point you need to appreciate. There is no room, there is no scope for imagination in exam hall. Maybe according to Albert Einstein, what is going to be the dosages? If you start thinking in the exam hall, no, khatam. Exam hall, you have to carry cauda equina, not your brain. Brain, keep it at home, or you put it in the locker in the bank. Carry the cauda equina. It should keep answering, oh, this is A, that is B, this is C, right? Exam hall means no thinking. If you are thinking, you are not ready for this entrance, you are ready for the next entrance. That too after you attend Dr. Murali Bharadwaz coaching, right? So, pregnant female reporting first time at 4.5 months to 7th month. What is her status? And received 2 doses of TT. 4th month, 4.5 months to 7th month, if she aa gaya and received 2 doses of TT, she will be declared what? Completely immunized for current pregnancy and subsequent half protection for the next 3 years. So that if she becomes pregnant within the next 3 years, she receives the booster. So half protection. If she reported first time at 8th month to 9th month and received 2 doses of TT, then also she will be called partially immunized for current pregnancy. Right? Because at 9th month you gave second dose. Immediately next day she delivered. So immunity kahan milega? So she will be declared as what? Partially immunized for current pregnancy and also partially immunized for the next half protection for next 3 years. She is a pregnant female reporting for the first time just before the delivery or post-delivery, after the delivery, and received 2 doses of TT. You consider that she is unimmunized for the current pregnancy and half protection for next 3 years. If a child is born to an unimmunized or a partially immunized, means she reported after, when do you call partially immunized? Partially immunized, if she came first time at 8th month to 9th month, then she is partially immunized and received 2 doses. Then you call partially immunized. Then that is an indication to give to the newborn 750 international units of antitoxin, the heterologous serum, within 6 hours of birth. So this serum has what? Antibodies. Right? Now once more I told you the other day, what is active immunity, what is passive immunity? A lot of people have a confusion. They think if you give live vaccine, it is active, otherwise it is passive. No. Whether you give live vaccine or whether you give killed vaccine, you are causing antigenic memory. Antigenic memory to produce antibody. So it is an active immunity. But passive means if you happen to give antibody serum or through placenta he got antibodies from the mother, that is what? Passive immunity. Be very sure about it. It does not have immunological memory, passive immunity. So what is the age limit of BCG? It is up to 1 year of age for the direct BCG, and more than 1 year, either his grandpa or his grandma, somebody might have coughed on his face, the little kid, he might have developed subclinical immunity beyond 1 year. That's the reason beyond 1 year, first time you have to give BCG means you need to check for MAN2. If the MAN2 is negative, then give BCG. If the MAN2 is positive, don't give BCG. Then age limit for OPV, up to 5 years of age. Reason? Because it is most common at less than 5 years. Simple. That's the only reason. Right? Age limit for DPT up to 7 years. DPT ke liye 7 years. Age limit for hepatitis B up to 1 year. Then age limit for measles vaccine is up to 5 years. Because the most common age is less than 5 years. Then Age limit for vitamin A supplementation is up to 5 years because xerophthalmia is most common at less than 5 years. Then age limit for DPT is up to 7 years because diphtheria cases are very common up to 7 years. All these are numerical values you need to remember. Last 30 days ke masala mein add karo. That's very important. Age limit for Japanese encephalitis vaccine 15 years up to. And for TT, there is no age limit. Just like NEETPG preparation, there is no age limit. So NEETPG is as good as the bloody dirty Corynebacterium, Clostridium tetani. That's what you need to remember. Now, a completely unimmunized child 9 months of age. 9 months of age may completely, till now, he doesn't know what is immunization. He comes from Adilabad forest area. What will you do? You will give BCG. Yes. BCG. Because beyond 12 months, BCG, you need to do the man-to and check. DPT, 1 booster. Next 2 doses, 1 month apart each, and booster after 1 year. Right? Then OPV1, you need to give, and next 2 doses 1 month apart, and a booster after first year of 3rd dose. Hep B1, next 2 doses 1 month apart each. Then you need to give measles. Then you need to give vitamin A 1 lakh internationals. This is what you need to give. Tap, everything on his body. If he comes completely unimmunized at 9 months. This is a favorite MCQ of examiner. If he is completely unimmunized child, 18 months of age, that means already 12 months over. So, BCG only after MAN2. Then DPT1 and next 2 doses 1 month apart and a booster after 1 year of 3rd dose. Then you need to give one OPV1 and next 2 doses 1 month apart and booster after 1 year of 3rd dose. Then measles, if he has not suffered from measles previously, then you need to give measles. Because the chance of getting measles up to 5 years now. That's the reason up to what age you can still give vaccine, you need to remember. Then vitamin A, 2 lakh international units you need to give. If he comes at 18 months. If he comes at 9 months, 1 lakh deke, uske baad 2 lakh, up to 17. You know that, right? Now, if he is completely unimmunized and came at 30 months of age, what do you want to do? You have to give BCG only after the MAN2. Indirect. Then you need to give DPT1, OPV1, measles if he has not suffered earlier. This is what you need to give if he comes at 4 years of age. That's a point you need to know. So now let us quickly know a few classical specific complications of the vaccines. Hepatitis B rarely can cause anaphylaxis. MMR, what are the 3 complications you remember? Thrombocytopenia, febrile seizures, anaphylaxis, encephalopathy with measles and MMR. Rubella and MMR, they can cause arthralgia. These are all specific, though rare complications. Pertussis or DPT whole cell vaccine. It can lead to seizures, anaphylaxis, encephalopathy. It's called persistent encephalopathy if it is more than 3 hours. Inconsolable screaming, then hypotonic, hyporesponsive episode it is called. Suddenly kid will become hypotonic, hyporesponsive, and episode will be there. So this kind of things bring discredit to the vaccination programs. And if you are the medical officer there, be ready for stone pelting. And after doing with itna hard work करके MD बनने के बाद पत्थर और जूतों का sound सुनना पड़ता. Now comes cold chain. So what is a cold chain? Cold chain is mainly for transportation, storage from the point of manufacturing to the point of administration. So what is the cold chain temperature of vaccines? OPV routinely stored at +2 to +8, long term -20 to -40. Yellow fever vaccine -30 to +5. And all other vaccines are +2 to +8. You will not forget this. Once more, dirty numeric last 30 days. Isko puja karna padta, right? Then comes +2 to +8 is hence called cold chain temperature. Diluents, they can be stored at +2 to +8 and they can be kept outside the cold chain even at room temperature. That's what you need to know. Then vitamin A also is stored outside the cold chain at room temperature. A lot of times examiner will ask, which of the following should not be kept at cold chain temperature but at room temperature? Vitamin A among the options. Now, state level may, what are the cold chain facilities? And district level may, what are they? PHC level may, what are they? Sub-center level may, what are they? Let us be sure. State or regional level, the cold chain components are walk-in cold chains, walk-in cold rooms, +2 to +8. Then you can use 3 months storage you can do in walk-in cold rooms. WIC may, how many days? 3 months. Walk-in freezers, WIF may, -20 to -40 degrees, and you can store up to 3 months, even in them also. District level may, what are the things that are available? Large ILR. What is the ILR? Ice-lined refrigerator. Examiner definitely puchega a question. And it has +2 to +8 degrees temperature and 1 month storage. Large DF bole to deep freezer, 20 to -40 degrees. And here also you can store for 1 month. Then PHC level, what are the cold chain components that you have? You have small ILR like this, +2 to +8 degrees, 1 month storage. Small DFs will be available, deep freezers, -20 to -40 and 1 month storage. Then sub-center level, what do you have? You have a vaccine carrier like this, +2 to +8 degrees, and you can store for 48 to 72 hours. Only 48 to 72 hours. Then you have day carriers, +2 to +8. They are also similar to vaccine carriers, day carriers. 48 to 72 hours of storage is permitted. So, when you are there in the field, in the session, under the tent, what is that you will use? Fully frozen ice pack, +2 to +8 degrees, 1 to 3 hours storage is being permitted. So what is the most important of all this? आपको deep freezer मालूम है, ice lined refrigerator मालूम है, vaccine day carriers है, ये सब चीजों में most important component of cold chain कौन सा? Ice lined refrigerator should be your parrot-like answer for the tomorrow's exam. And if I ask you a question, what is the temperature of the cold chain in India? +2 to +8 degrees Celsius is what you need to remember. And what is the minimum level of the vaccine storage? In India, there is a state, regional level, district level, PHC level, sub-center level, and at the field. Out of all these, PHC is called the last place where you can store. Because you don't store at sub-center. You don't store it sub-center. You don't store it day center, in the field. So the last place where storage is available is primary health center is a supermarket from where you will bring it to the local home, right? And maximum chance of cold chain failure कहाँ होता? PHC में power will be there, powerful doctor will be sometimes there, and nurses will be also sometimes available. So chance of power going off is lesser for the refrigerator. Sub-center village level is the maximum chance of cold chain failure, because there the person who administer may put Coca-Cola in it and put out the vaccines outside. So be very sure about. And how do you monitor the temperature of the cold chain at PHC? We use dial thermometer is what you need to remember. Now, what is the temperature of ice-lined refrigerator in India? +2 to +8 is what you need to remember. And temperature monitoring, how frequently you should do with the dial thermometer? Twice daily, not thrice, not once, right? Then, which vaccine you can keep in ILR? All vaccines can be put in ILR. And district may, in the districts, whatever the ILR that you are keeping, no, what is its capacity? 240 to 300 liters. PHC's my ILR capacity is 140 liters. That is called social and preventive medicine का effect on the brain, right? ये सब पढ़ के depression आता है. वाह, 240 liters, 140 liters, right? ILRs, how, I mean, horizontal level surface, how far away from the wall you have to keep? 10 centimeters. ये मालूम नहीं है तो भी 10,000 ranks पीछे पड़ेगा, right? 10 centimeters away from the wall, you have to keep it. And uninterrupted electricity, how many hours should be available for the ILR to maintain temperature? 8 hours uninterrupted temperature है तो भी पूरा दिन काम चलेगा. 16 hours नहीं है तो भी ILR can still maintain the cold chain failure doesn't happen, is what you need to remember. And the ice pack, how do you prepare for ice pack? Typically you put in deep freezer, that will turn it into a ice with which ice pack is prepared. And where to use ice pack? To maintain the temperature during transportation, because you don't have electric power, no. And temperature maintenance during immunization session also, your ice pack will help you. That's a point you need to remember. And ice pack, total, how much water will be there in the ice pack? That is the misery. Don't worry. Septic tank, latrine का depth कितना है भी पूछेगा examiner, right? You have to remember what is the size of the sand particles in the rapid sand filter also you have to remember before you become cardiologist, right? 320 to 340 ml capacity. And the ice pack has a horizontal mark. Only till there you have to fill water. Why? The only place where physics help us. We studied so much physics to get into medical college. Now, where will it help here? Water expands on freezing, said the physics teacher in the coaching center. After that, once more, I used that knowledge only while studying sleep promoting medicine, right? And nothing should be added to water for freezing an ice pack. Matlab, whiskey or cold chilled beer ko add mat karna. So that's very important. And ice pack has how many holes? 2 holes. And is hole mein rakhega aap vaccine ko. That's a point you need to understand. And we use dial thermometer to monitor the temperature of cold chain even at PHC, is what you need to remember. Now, tomorrow's examiner will give you one thermometer. He will ask you, is it a dial thermometer? Is it a Carter thermometer? Is it, there are so many thermometers. Clinical thermometer. Worst case, don't answer it is a BP apparatus. So, dial thermometer is based on the principle of thermocouple. And recommended number of times you monitor it PHC level is twice. That's what you need to remember. So, doctor, we finished 135 points. in a 1 hour, 10 minutes. Very good. R. Kumar, Ganesh Reddy, Neelu Sharma, आप सबके फरमाइश पे पूजा सिंह, Pooja Singh or Teja. Thank you all for coming to the class. And as teachers, we will be very happy to see a crowd of students always. In the same floor, I used to deliver to all these things what used to not exist about 25 years ago in the same building. Almost all 200 students used to sit early morning, 5 o'clock. I used to come and deliver class. Usmania, Gandhi, only those days, Usmania, Gandhi, Deccan, only 3 colleges. So many private colleges were not there. So they used to sit and then I used to deliver a class. So I want once more the days to come back where every day we meet. Please come at morning, 10 o'clock only he'll open. Air conditioning is there. Happily sit and study use it like a learning center, study room, right? We'll also put one coffee machine if at least 10, 15 people come. So have a coffee, study, enjoy. Evening I'll come and deliver a 2 hours class and we all go home. So that's the plan and we will definitely crack the entrance exam. Thank you very much. So tomorrow I will not be able to deliver. I'll be there to administer the marriage vows to a young boy. I had a lot of debate, fight with my son to make him agree to marry at 24 because I produced him when I was just 23. So that's the reason I say that, marriage gives you another human being in your heart. See, tomorrow you finish MD pediatrics and then marry another MD gynecology. मजा क्या है? आप MBBS लेवल में हो और एक साथी जो एंट्रेंस के लिए प्रिपेयर हो रहे हैं उनके साथ मिलके आप दोनों टॉपर्स बने तो that is the real kick of life, right? So somebody who can walk into our life taking the risk of our poverty will remain a lifelong companion to understand us. One way of looking, right? So thank you very much.